So when we get the question, what do I need to prepare for cosmetic plastic surgery? This is a very, very broad question that has a very, very broad answer. However, I'm going to try to break it down so it doesn't seem so daunting. So the first thing that you have to do is look for a surgeon in your area or afar that seems to fit your goals. And what I mean by that is there are a lot of different cosmetic plastic surgery approaches. There's a naturalistic approach, there's a very augmented approach, there is minimal approach, there is very, very intense approach. Each surgeon has a different way of approaching each individual cosmetic surgical issue. So when I like to think about it is I like to think you need to look at the clinic and the surgeon first. Make sure that you look at the before and after pictures, make sure that it's matching kind of your ideal outcome for your body with what they've done. Second is making sure that it is an actual plastic surgeon. They went through plastic and reconstructive surgical training. That can be a residency program, which is 6 years, or it can be a residency program followed by a plastic and reconstructive surgery fellowship, which is what I did. So I am a fellowship trained plastic and reconstructive surgeon that did extra cosmetic surgical training down in Austin, Texas, to just hone my cosmetic surgery skills. That is of the utmost importance because there are a lot of surgeons or physicians out there that call themselves plastic surgeons, or more specifically, cosmetic surgeons, which means they are not plastic surgeons. They are another field of physicians that took a course, which is about anywhere from 6 months to 12 months, and they got their cosmetic surgical approval. Mine took about 7 years after medical school, plus extra training. So it really is important to find out how they've trained, where they've trained. And then third, and even more importantly, go to multiple consultations. Make sure you feel comfortable with the surgeon, their staff, and their approach. So this is a lot of different things that you have to think about before you even start the consultation process. Where is this surgeon and his or her clinic located? Do I want to stay near home or do I want to travel to get this done? If I want to travel, do they have the necessary architecture in place in the clinic to help with travel? Do their results match what I hope to achieve with my surgery? Are they an appropriately trained surgeon? After you've done all that, then you get to go and actually interact with the surgeon. Never sign on with a surgery if you haven't met the surgeon beforehand. All of these things are of the utmost importance. And when you put them all together, what you're going to find is you're going to come in more educated. You are going to come in with great, appropriate questions. And hopefully you leave your consultation feeling more empowered, more educated, and ready to make this very life-changing decision comfortably. You don't feel pushed. You don't feel that you were actually coaxed into doing anything. You just feel you were educated and then you've made a good decision. And then when you are done with your surgery, you're going to be thrilled and you're not going to have that buyer's remorse, so to speak. So again, the process of finding or preparing for a cosmetic surgery or surgical consultation needs to be done with intent. As long as you do that, you'll be well educated, you'll be comfortable, your decisions won't be forced upon you. One of the big factors in it is how to prepare also for the surgery. So when we're doing that in the consultation process, you should be educated on what the recovery process is going to be, what the surgical day is going to be, how to prepare for that surgical day. So what I do in my practice is that I make sure that each patient has a written out, basically guidebook on what to do to prepare for your upcoming plastic surgery. What that means for my cosmetic plastic surgery patients is what to do leading up to your surgical day. That's diet, that's exercise, that's hydration, medications, what to take, what not to take, what to prepare for in your home in terms of, okay, what's the easiest place for me to recover at? Is it in my bedroom? Is it in my living room? Is it downstairs? Is it upstairs? All of these things can be well defined prior to the surgery. Then the surgical date, we have in there how to get to where we're operating, where to park, so that there is no confusion. We follow up before the surgery. I call my patients personally. check on them, make sure they don't have any last minute questions the day before surgery. So hopefully we can get them answered to give them a little bit more ease because we know they're going to be nervous the night before surgery. After surgery, we also tell them what to prepare for. The medications you're going to be taking for pain control, for muscle spasms, if you need antibiotics, if you don't need antibiotics, are you going to need drains? How do you take care of the drains? Are you going to be leaking? Like if you have vasoliposuction, what to do to take care of that, how long it should last, how to prep your home for this. Also, when are you going to be seen for your follow-up appointments? Who is going to be seeing you at your follow-up appointments? In my clinic, you see me. It's laid out for you prior. We have everything scheduled to their comfort level so that way we're making it work for them so that it's just as stress-free as a overall experience as can be, because we know it's going to be stressful. It is going to be very anxiety provoking. So anything we could do at my clinic to prepare somebody for a cosmetic surgery, we do upfront, during, and after, so that each patient, when they're recovering, they know what to expect. It makes it much easier. Their pain will be controlled. They will have access to me at all times, which means they have my personal cell phone number. They have our clinic number. We have an answering service. We make sure that there is no lapse in access. And that cannot be any more important to an experience as the surgery itself.